In popular culture and the psyche of many societies, the penis is more than just a sex organ. It is often associated with concepts of strength, masculinity, sexual attractiveness, and even male self-confidence. This has led to many men, of all ages, sharing a secret concern: is my size normal? This seemingly simple question has become the subject of a series of medical studies, psychological surveys, and even industries that exploit men's insecurities to sell drugs, devices, and even surgeries. The question is, what is a normal penis size? And why has it become such an obsession in the modern world? Not only that, many people measure their size but are not sure if they are doing it correctly. How to measure penis length and circumference accurately, with medical reference, is something that very few people know. This long essay will go into a comprehensive analysis of the above topic from many perspectives: science, psychology, society, and medicine, aiming to clearly answer things that are often misunderstood or exaggerated unrealistically. At the same time, the article also guides how to measure size according to medical standards, providing reliable research data, helping readers understand correctly, avoid unnecessary worries, and raise awareness about men's physiological health. The question, what is the average penis size, may seem simple, but to answer it accurately, we must look at reliable scientific research data. Over the years, male doctors, sex psychologists, and medical professionals have conducted dozens of surveys on tens of thousands of men of different ethnicities, ages, and regions in order to find the most objective answer. One of the largest and most frequently cited studies is a meta-analysis published in 2015 in the British Journal of Urology International, BJUI. A team from King's College London compiled data from 15,521 men from around the world. The results were remarkable and are considered the gold standard in determining average size. According to the study, the average penis length is as follows: flat, about 9.16 centimeters; fully erect, about 13.12 centimeters; average circumference around the shaft flat, about 9.31 centimeters; erect, about 11.66 centimeters. What's important here is the distribution of sizes. That is, a lot of men fall somewhere between 12 and 14 centimeters when erect, not too big, not too small, and are perfectly normal. Penis lengths over 18 centimeters when erect are rare, even within 2.5% of the global male population. But sadly, most men don't believe they're normal. In the psychological survey that accompanied the study, more than 45% of men believed their penises were smaller than average, even though they were perfectly within the norm. What causes this cognitive distortion? There are many reasons, but the most prominent are the influence of adult films, the culture of showing off, and the lack of formal sex education. In porn, male actors are often cast based on their exceptional size to enhance the visual element, making the audience think that it is the norm. In addition, comparisons in public bathrooms, locker rooms, or even through negative comments from ex-partners can create lasting psychological wounds. This leads to a syndrome in psychiatric medicine called penile dysmorphophobia, that is, an obsessive-compulsive disorder of penis size. People with this syndrome often believe that their little guy is too small, even though in reality it is completely normal. This syndrome can cause anxiety, depression, avoidance of sex, and seriously affect the quality of life. In addition, we must also understand that penis size does not increase forever with age. In fact, it grows most during puberty, ages 12 to 18, then stabilizes. Some people believe that exercise, diet, or medication can make it longer in adulthood, but this is not clearly proven. There are factors such as weight gain, which thickens the fat layer at the base of the penis, that can make the penis look smaller, but that is a visual effect, not an actual shrinking. Others are confused when they see a short flaccid penis that is quite large when erect, or vice versa. This is completely normal, as there are two common physiological types: grower, small when flaccid, but significantly longer when erect, accounting for about 79%. Shower, relatively large when flaccid, but not much longer when erect, accounting for about 21%. None is better than the other. It's all natural biological diversity. What matters is not the flaccid or erect measurement, but the ability to achieve sufficient hardness and comfort during intercourse. The average penis size of men around the world is not as large as people often imagine. In fact, the majority of men are within the normal range, and what is much more important is function, confidence, and the quality of sexual relationships, not just numbers. One of the common reasons why men feel insecure about their size is because of measuring incorrectly. Some people use a cloth ruler, some measure when not erect, and some do not press it against the pubic bone. All of these small mistakes can cause you to lose a few centimeters unjustly and easily lead to misunderstandings. How to measure length correctly? Fully erect, measurement is only meaningful when the penis is in a state of maximum erection. Use a straight, hard ruler. Plastic or metal rulers are best. Do not use a tape measure because it can be distorted by curvature. Press the ruler against the pubic bone, that is, the base of the penis, where it meets the lower abdomen. If there is a thick layer of belly fat, you need to press gently to get the actual measurement. Pull straight to the tip of the glans, do not count the foreskin if it is not circumcised. If the penis is curved, still measure in a straight line, not in a curve. Record the exact result, do not round. How to measure girth, circumference? Use a soft measuring tape, the kind used to measure clothing. Wrap it around the middle of the erect penis. Not too tight or too loose. Read the result at the junction. Measure several times on different days, because mood, temperature, and arousal can all affect the actual size. Don't rely on just one measurement. Measuring correctly not only helps you understand your body better, but also avoids unnecessary anxiety from seemingly substandard numbers. There is no standard penis size. Many factors influence each person's measurements, including 1. Genetics. The primary determinant. If your family has a tendency toward short or tall penises, you will inherit that too. No food or exercise can overcome genetics. 2. Ethnicity and race. While there are differences between ethnic groups, they are not as significant as people think. Many misleading statistics are spread online without scientific verification. 3. Weight and belly fat. People with large bellies or excess fat around the pubic bone often find that their penis sinks inward, making it appear shorter than normal. In reality, it is not smaller, but simply hidden. Losing weight can help regain lost length. 4. Hormones, testosterone. A lack of male sex hormones during puberty can slow or affect the growth of the penis. However, after puberty, testosterone supplementation does not increase the size any further. 5. Lifestyle habits. Smoking, alcohol, obesity, prolonged stress, do not physically shorten the penis, but they can reduce blood flow, affect the ability to get an erection, thereby preventing the penis from reaching its maximum size during sex. You can't control your genes or your race, but you can control your weight, lifestyle, and cardiovascular health, all of which directly contribute to your penis functioning and performing at its best. Many men have a completely normal penis size, but still feel that they are not enough. This is not a physiological problem, but a form of body dysmorphic disorder, BDD, more specifically penile dysmorphophobia, excessive anxiety about penis size. Men with this syndrome may experience anxiety when changing clothes in public, avoiding sex for fear of being judged, often looking at the penis in the mirror with a negative mood, obsessively comparing themselves to others, seeking medication, extenders, or even surgery even when it is not necessary. More dangerously, this condition can lead to psychological erectile dysfunction, that is, not being able to get an erection even though the body is completely healthy, just because the mind is always stressed and doubting oneself. The solution does not lie in enlarging, but in psychotherapy, cognitive behavioral therapy, or simply proper sex education, to understand that normal does not mean small. Over the years, the internet and the media have fed many false beliefs. 1. Bigger is better. False. Many studies have shown that the ideal length to satisfy your partner ranges from 12 to 15 centimeters. Penis that are too long can cause pain, hit the cervix, or make it difficult for your partner to reach orgasm. 2. Female partners always judge size. False. In a survey from the Journal of Sexual Medicine, more than 85% of women said they were satisfied with their partner's size, but nearly 50% of men did not believe this. Women care more about care, emotional connection, and self-confidence than length. 3. Men with small penises are less capable. Absolutely false. Sexual performance is not just about size, but about skill, knowledge, and understanding of your partner's needs. Many men think that if they are not long or thick enough, their partner will not be able to achieve orgasm. In fact, that is not entirely true. The most sensitive area in the vagina is about 5 to 7 centimeters at the entrance. This area is rich in nerve endings and is close to the G-spot. Therefore, a penis with a length of 12 to 13 centimeters is enough for effective stimulation. In addition, the vagina is highly elastic. It will adapt to any size, big or small. What is more important is communication, movement, rhythm, and the comfort of your partner. In sex, understanding and emotional interaction play a role twice as much as size. A person can be small in numbers, but big in emotions, skills, and dedication, and that is what makes for a great experience. Once you understand that most concerns about size are unnecessary, the next question is often, if you still want to increase the size, is there an effective and safe way to do it? 1. Ineffective or dangerous methods. Pills, gels, dietary supplements. There is no scientific evidence that they can make the penis longer or bigger. Some may contain steroids or chemicals that can damage the liver, kidneys, or endocrine system. Jelqing exercises. This is a method that is often shared on forums, but there is no scientific evidence to prove its effectiveness. Many people have damaged erectile tissue, bruising, or loss of sensation due to incorrect practice. Extenders or vacuum pumps can produce temporary effects, especially in the girth. However, using them for too long or applying too much pressure can cause blood clots, tissue fibrosis, leading to penile curvature or erectile dysfunction. Lengthening surgery. It is possible to free part of the base of the penis that is inside the body by cutting the suspensory ligament. This results in an increase of 1 to 2 centimeters in flaccid length, but no noticeable change when erect. In addition, the risk of loss of sensation, infection, and even permanent erectile dysfunction is completely real. 2. Things you can do to make your penis appear larger. Reduce belly fat. The fat on the pubic area partially covers the base of the penis. Reducing fat can help look 1 to 2 centimeters longer without surgery. Improve blood circulation. A healthy lifestyle helps erectile tissue reach its maximum during erection. Stop smoking, exercise, eat healthy, and get enough sleep. Kegels and pelvic floor health. Increasing control of the PC muscle improves erection hardness and duration, creating a thicker, fuller feeling during sex. Sex is more than just a physical act, it's a whole person experience. Sexual compatibility comes from many factors. Open communication, understanding each other's needs, talking about what you both like and don't like. A relaxed mind. A confident, relaxed, and good listener is much more attractive than a stressed-out man with a big weapon. Skills and knowledge. Understanding the female body, the G-spot, how to stimulate effectively, and creating a sense of security. This is what your partner will remember forever. Emotional presence. Caring, attentive, and being there sincerely in the intimate moment. That's the pinnacle of sensuality. If you only worry about size and forget about emotional connection, no matter how long it is, you will have a hard time satisfying your partner. But if you understand your worth and invest in the relationship, size is no longer the deciding factor. You don't need to be longer. You need to understand yourself better. Your strength, masculinity, and attractiveness are not about the number on the scale, but about how you understand your body, take care of yourself, connect with others, and live confidently from within. If you found this video helpful, please share it with a friend who needs it. Leave a comment about what you care about most. And don't forget to subscribe to follow more scientific, honest, and unadulterated content about men's sexual health. We deserve an open, unashamed, unbiased conversation about a very natural part of every man's body. Take care of your body. understand it, and be proud of who you are.